Good afternoon, good morning, good evening, wherever time zone everyone's from. Thank you so much for joining us today for our Road to HINAC series presentation by the Black United Leadership Initiative. The title of that is The War on Black Bodies, Divesting from Racist Health Policies. And bear with me as I move a little slow through introducing or getting into our webinar, as I make sure everything on the back end is accessible for Spanish translation and for our panelists to be able to engage with you all. So just give me just one moment because I forgot to do something.
So while Kamari is doing that, if y'all could put in the chat maybe 2 words of how you're feeling right now and maybe where you are currently joining us from. This is a conversation not only with us, but we want to get to know you all because we are building as well. So where y'all joining us from? Go ahead and put it in the chat box. Hey, Chicago. Mississippi, we got the South. More South, Jacksonville. Iowa, Texas. Okay, Canada. Canada, be ready. A lot of us might be coming your way soon.
So true. So true.
Listen. Hey, New York, Springfield. Hey, Nikki. Chicago. I'm currently in California. I'm in Long Beach.
Cool.
Okay, go ahead.
Great. Okay. So clicking on the slide, right? So we're gonna get right into it. This presentation, this webinar today is part of the HIV is Not a Crime National Training Academy, which is going virtual. It is planned and put together by the US People Living with HIV Caucus, the Sarah Project, Thrive SS, Positively Trans, and Positive Women's Network. As with everything going on with COVID, we were supposed to gather in May of this year. So in lieu of being able to gather in person, we created a Road to HINAC series, and this is the second installment of that series. Just a little bit of housekeeping, as hopefully most folks are familiar with the Zoom platform by now, since the whole world's gone virtual. Everyone should be displayed on the call as muted, correction to that slide. You'll be able to unmute yourselves on your own. But if you're not speaking, to please stay mute to cut down on any background noise. And if you happen to be using a landline and take another phone call, please just hang up to avoid any hold music from transferring to our webinar, and then just call back in. The recording of this webinar will be made available at the completion of our discussion. And meanwhile, use the chat box as you have been to let us know where you're from, the Q&A feature on your end, or just raise your hand to join in on our discussion. Throughout our discussion, our chat moderators will be putting links that are for issues or things that are brought up by our panelists for you to be able to access throughout our webinar today. And I would like to give a special thanks to our Spanish translator for this discussion. And I put your name wrong, I apologize, but it's Jose Romero, not Ramos. And just some instructions from Jose.
Yes, so today's call will be bilingual. If you haven't used interpretation on Zoom before, you can go ahead and click on the little globe at the bottom of your screen if you're accessing via a computer, or by clicking the ellipsis at the bottom of your phone, and then hitting more and choosing the language you'd like to listen in for this call. Esta llamada va a ser interpretada en español. Si es tu primera vez escuchando interpretación a medida de Zoom, puedes seleccionar el botón con el globo y escoger el idioma que quieres, o si te estás uniendo por tu teléfono, seleccionar los 3 puntitos y seleccionar el idioma en cual quieres escuchar. Gracias a Cero por practicar la justicia del lenguaje. Thank you to the Zero Project for practicing language justice with us today.
Thank you so much. And then okay, so to let everyone know what you're here for today, I'm sure you've seen the promotion. We have been pushing this really hard for this critical conversation today, but today we'll be discussing ways to increase awareness of needs to support Black leadership, educating community on the intersection of policing and healthcare. We'll be discussing the relationship between abolition, mass incarceration, and healthcare. We'll be using examples of current war on Black bodies, such as the whistleblower on sterilization of women being detained by ICE. And we'll be discussing relationship between, repeating it again, that's how important it is, abolition, mass incarceration, and healthcare. This conversation is going to be moderated by Diane Burkholder and Deirdre Johnson, and I forgot to say who I am. I'm Kamari Lackery with the Zero Project. I'm the Southern Engagement Community Coordinator, and I will be turning this over to Diane and Deirdre today.
Thank you so much for joining us today. I will be moderating us through with our amazing panelists. Deidre will be helping out with the chat. So if you have any questions, please put them in the chat. They will be looking for them. Also, I want to give a shout out to Vanita, who is also helping out with Positive Women's Network as far as the chat. So thank you all so much for being here with us today. This was a critical conversation. We've been chatting and organizing this really for months. When we found out HIV is not a crime, was not going to happen in person, we said we need to do something in light of that. We still need to build with folks, particularly with the criminalization of folks related to COVID. This is a conversation that the HIV community has been having for decades. And so what does that mean to center those that are most impacted, those that are living with HIV, those with other chronic illnesses, in talking about COVID, criminalization of Black bodies? Go to the next slide. Go ahead and go to the next. Thank you. So just to get a little bit of a background from about Bully, we formally started, kicked off as the Black United Leadership. We were the Institute because we're going to be a one-time thing, and there was such a desire from both the organizers and the participants to continue to build that we changed our name to the Black United Leadership Initiative. And the purpose is to nurture and create Black leadership. So in 2018, HIV is Not a Crime 3 conference, which is a biannual conference, we had a Black-led convening that was put together by Black HIV activists who wanted to have a space for Black activists working on HIV criminalization to discuss a lot of issues, particularly to develop a place to help empower Black participants and to challenge racism and bias that may occur at HIV is Not a Crime. What does it mean to talk about race and racism and anti-Blackness regarding HIV, but also to HIV criminalization? We wanted to connect other Black folks that are doing HIV crim work around the country to discuss HIV criminalization movement and the work that we're collectively doing to address the issues from a racial justice lens. We talk about race and racism and HIV, but we sometimes actually don't talk about anti-racism. What does it mean? What are the foundational issues beyond the disparities in our statistics? And so what does it mean to build with other Black folks? And also HIV criminalization is not a discussion that we have, it's gaining momentum, particularly I would say the last 5 years, but it's a discussion we haven't been having in the HIV community for a long time. I will say, as somebody who was in California for years, I didn't know about HIV criminalization, although I had worked in the field for 10 years, until I moved to Missouri and found out how atrocious the laws are there. And to explore the possibility of an ongoing network of Black activists doing connecting advocacy work around HIV criminalization. So what does it mean to connect Black folks with other Black folks in an unapologetically Black space? What does that mean to really support and nurture and talk about Black identity of development for Black folks? To be strong in our Blackness. And so from that space, we had 40 people that attended. Many people, it was the first time they had been in a Black only space. And it was also a time that people were getting to know each other for the first time. We shared presentations on developing a Black agenda for addressing HIV criminalization in the US. We did a historical look back. We talked about building strategies for addressing race and racial justice within the HIV criminalization movement. And we also talked about building strategies to address the lack of HIV criminalization within Black-led movements around prisons, policing, and criminalization. We're at a time where we're talking, about the uprisings across the country, the movement for Black Lives Matter, racial justice, however you want to frame it. But what does that mean to actually talk about this conversation within the larger movement? There's often disconnect and we live in silos. So we wanted to bridge some of those gaps today. So that was 2 years ago. And here we are, we've been organizing, and I'm getting ready to do Max. We pull up his bio. We've been organizing and connecting, and how do we talk about building this space that happened in 2018? We've been involved in other HIV conferences, connecting with other Black HIV activists. And so we are looking at how to really support one another. So we're to kick us off today, I'm going to introduce Max Boykin. Excuse me while I pull up his bio. Max Boykin is the Policy and Organizing Manager of the Black AIDS Institute, otherwise known as BAI. At his heart, he's an organizer, activist, and believer, and we all have to be the change we want to see. Before coming to BAI, moving back to Atlanta, he was he's a manager of organizing at the AIDS Foundation of Chicago, along with the manager of HIV Prevention Justice Alliance. Boykin is also a member of the Black Youth Project 100, or BYP 100, a Robert Wood Johnson Foundation Culture of Health leader, and is on the steering committee for the collaboration of health equity for Cook County. His organizing ranges from direct action to civic engagement, conscious raising, to coalition building. Originally from the suburbs of Atlanta, he and his two sisters were raised by his parents who were brought up in Atlanta during the time of civil rights and Black Power movements. He's been an organizer for a wide range of issue-based political and union organizing, and he's always worked in primarily Black and marginalized community, and love working with people to make sure they are uplifted and liberated. So we're gonna go ahead and turn it over to Max to chat with us today about what the war on the Black bodies look like. Thank you. Go ahead, Max.
Hey, everyone, and thank you so very much for the introduction, Diane. It's been a pleasure working with everyone in this group continuously and seeing how we build. So when we talk about the war on Black bodies and what it's looking like, we're talking about the continued investment in policing that we have seen increasingly over the last 30 years, but specifically in times of policing, and policing being historically how in which the folks that grabbed Black folks who are running away for freedom, and understanding that continued act of thought around policing and how policing happens to Black bodies is something that we have seen. But that investment has gone up actually since really it was actually the larger investment in policing happened after our continued work from the civil rights movement and continued fighting for access of Black rights, fighting back against many of the pieces that happened in the 60s and 70s. And also we had ended a war, or working to end a war in Vietnam, and also continuously working until the end of the Cold War in the 1990s. And they had to do something with much of that weaponry. And that meant those police officers then had access to weapons, and this was further fantasized about by seeing the continued policing that we saw on TV. And saying like, oh my God, things are getting so much worse. The bank robbers and the folks that are doing all these wonderful things, they have access to automatic machine guns. Now they need access. The police need access to automatic machine guns. And then on top of that, we also saw further investment in such things as tanks, and especially since the continued quote unquote war on terror that started under George W. Bush has continued to see that the further investing in policing that we have seen over this time. And then we have also seen since the 90s a intersection of how that works with HIV, as in we also started to criminalize HIV. The 90s was known for its further criminalization of folks, the 3 strike laws that happened under President Clinton, along with the further investment in the mass incarceration system, making sure that more folks were within the jails, and then just seeing a larger increase of Black folks within the prison system. Also, we see with that increased HIV rates. First started in disproportionately impacting Black communities as it did originate on the continent of Africa, then moving over, and for many of us, seeing how in which it is devastated Black communities. And even though it was first known as a white gay man's disease, that was not the people that were first impacted by HIV. We know that now, and we are seeing that this still disproportionately impacts Black folks. We also see that Black folks are disproportionately impacted by HIV and the policing system. And so when they intersect, when they come together, it's actually showing that Black folks are disproportionately impacted by the HIV criminalization laws that are on the books. We have continuously seen that Black folks do not get access to plea bargains as often as folks that are criminalized by HIV criminalization that are white. We are also seeing they are more likely to serve more time, and again, be without the benefit of the doubt. We've even seen in the ways in which the media talks about a Black person who is a person living with HIV is talked about differently than a white person living with HIV, and almost used in the same way that we think about how Hillary Clinton used the term super predator. Is many times the way in which the verbiage and used around Black people who are living with HIV, who are used under criminalization law. And so when you see that increased money going into mass incarceration, increased funds going into policing, and then also the increased criminalization of Black bodies, and also through, and one of those things was through this thing that we call HIV criminalization laws that came out of the 90s. And actually were originally tied, and you'll hear more from Devin around what needs to be changed around the Ryan White, but was actually, when Ryan White was first being passed, was actually the for folks was to tell folks, hey, you actually need to put these laws on the books. That is one of the problems that we are continuously trying to fight back against now, as we are trying to change those criminalization laws. And one of the things that we're also seeing connected to all this is a need to increase the leadership for Black people in this time, and talking about how in which we are also able to see this reform. I'm just get to open up for some really dope panelists that y'all get to hear from about how we're changing some of those, how that change looks. But when we think about the increase of leadership, we're talking about the increase of leadership of folks, specifically Black people, but also Black people living with HIV, Black people who are disproportionately impacted by this, Black same-gender loving, Black transgender folks, making sure that they have access to these different spaces, knowing that HIV disproportionately impacts them, but also making sure that their advocacy is actually led by those voices throughout the work. And with also an increase of understanding for folks that are part of this work, they also have a different access to different things that are important to Black people. And when we talk about this and continue investing into policing, there is something that folks will talk more about, which is this piece around invest, divest. And this is taken directly from the Movement for Black Lives, which I do also want to say that invest, divest has been through many years of change as we've thought over, but has been made popular by the BYP 100 and some of the invest, divest campaigns. Started 5 years ago and continued through much of the work of the Movement for Black Lives, going into how in which we talk about defunding the police. But invest, divest is we demand investment in the education, health, and safety of Black people instead of investments in the criminalizing, caging, and harming of Black people. We want investment in Black communities determined by Black communities, and divestment from exploitative forces, including prisons, fossil fuels, police, surveillance, and exploitative corporations. So, as we say through those different pieces and how in which this all works, Tony Michelle Williams is going to go deeper into how those invest, divest campaigns look, but to also talk about the leadership, we have to invest in the leadership of these communities. And that also means investing in Black-led community-based organizations and aid service organizations, and to also work to divest from institutions that are fundamentally not doing the best service for them, and that they are racist in nature. And this comes from work that we've seen from I'm blanking out on names right now, but racial justice, HIV Racial Justice Now, which has talked about the divestment from institutions that are fundamentally still doing racist policies. And also, we have seen this more recently from Black South Rising to also talk about the divestment from institutions that are not doing what is necessary to make sure that our folks are being safe. And when we think about in a time where we're also dealing with multiple different pandemics, HIV, COVID-19, and the continued racism of this country, we have to start to pull away resources. That means calling funders. That means not having our folks or telling our people to go into those clinics that they will continue to see harm, and to make sure that fund is actually going into the investing of people that look like us, that are doing the culturally affirming work that is necessary, and to also make sure that we are destigmatizing HIV while also making sure that Black people are able to live in their whole lives. So those are important pieces for us. We'll be able to talk some more. And thank you for allowing me to be here.
Thank you. I have so many questions right now, but that is not my role right now. So I'm going to wait. Please put your questions in the chat box if you have them. I want to turn it over to Brianna so I got to know Brianna just briefly when we were setting up this presentation last week, but I became familiar with her when I saw a similar presentation that was hosted in Chicago. And I was like, I hope Brianna is able to be on this, right? And then here we are. So thank you for joining us, Brianna. Brianna Diaz, she/her, is the policy director for the Positive Women's Network USA, where she advocates for women and people of transgender experience living with HIV in the areas of criminal justice, healthcare, and reproductive rights, safety, and justice. Brianna is a queer Latinx woman whose lived experience deeply informs her advocacy. She received her law degree from American University, Washington College of Law. So thank you. Brianna's going to talk through us about the war of Black bodies and what it looks like about the intersection of criminalization of HIV and COVID-19. Thank you.
Yeah, thank you so much for that introduction. And thanks, Max, for laying all of HIV criminalization and its failures and violence, especially against the Black community. You know, it's unfortunate how policing, surveillance, and criminalization has become some sort of response to all public health pandemics, right? And so everything that Max just outlined in his overview of HIV criminalization has found its way into how our country, how our states, how our cities are responding to the COVID-19 pandemic. And so I'm very briefly going to condense what is typically a 90-minute presentation into 5 minutes and try to speak slowly because we have a translator. And as a naturally fast talker, I want to make sure folks get all the messaging. So, we know that COVID-19 has disproportionately impacted Black communities, and so has its criminalization. And so for those of you that may have not heard of what COVID-19 criminalization is, well, we're seeing it appear in 3 different ways. We're seeing criminalization through the enforcement of public health orders. We were pretty familiar with those at the beginning of the pandemic in March and April, when many states were issuing public health orders, right? Like mandatory shutdowns, where we were all stuck at home. There were curfews put in place and like those kind of things, as well as like mandatory mask orders that we're now starting to see or have seen, mostly at the county and city level, right? So there's been criminalization efforts in the enforcement of public health orders. There's also enforcement or criminalization through the enforcement of existing criminal laws. And the third version of criminalization that we've seen across the board is criminalization via enforcement of existing quarantine laws. And so what has this looked like in practice? Well, as I said earlier, we're seeing So as public health orders are created, unfortunately, states, cities, and counties rely on police or law enforcement to actually enforce those public health orders. And so what that has looked like in practice is things I'm sure many of you all have seen where you live, of cops stopping people in streets for gatherings, or police ticketing and giving citations to folks that aren't wearing masks, whether it's indoors or outdoors. Or we're also seeing criminalization efforts in the form of penalty enhancements or stacking crimes, criminal charges. And so an example of a penalty enhancement is like, you know, maybe you committed a crime like theft, but there are executive or public health orders at the state level where if you commit a crime during a health, like an emergency, the criminal charge is usually ratcheted up another degree. So something that could have formerly been only a misdemeanor has then been raised up to a felony for even minor crimes. We have seen that in states like Texas. We have seen that penalty enhancement used against Latinx and Black people just across the board. The racial disparities of that type of penalty enhancement is already documented and seen. You know, so when I said stacking of crimes, this has looked like an individual is arrested for a crime. We see this a lot with DUIs, unfortunately, but that person is arrested. They might cough near a cop or in the direction at one and just say, oh, I have COVID-19. We don't know if they do. We don't even need transmission to actually happen. Both those things probably sound pretty familiar if you've done HIV criminalization law. But then that person originally arrested for the DUI is then charged with an additional crime or stacked crime of biological terrorism. Like for just coughing at a cop and saying they had COVID-19, right? And so these are all issues, right? And like, so like we already see like the disparities in the criminalization of these things, and that has led to further policing of BIPOC communities, especially Black communities. I want to uplift a recent report that came out by the Community Resource Hub titled Unmasked. I will drop the link in the chat as soon as I'm done talking. That did a phenomenal job in reporting the racial disparities in COVID-19 policing specifically. And so I'm just going to read off a few of the statistics that we found, or that they found. And so, you know, policing during COVID-19, like I said, is like police are tasked with enforcement via public health orders or existing law. And what we found in this report was that Black, Indigenous, and other people of color were 2.5 times more likely to be policed and punished for COVID-19 orders than whites. Black people specifically were 4.5 times more likely than white people to be criminalized, to be charged, policed and punished for COVID-19 orders. So what we're seeing in the policing, in COVID-19 policing, is pretty much the exasperation of like broken windows policing, right? Like folks that have already been targeted by police, specifically Black folks and other people of color, are now, there's now a new way for cops to police them, and it's COVID-19. And then the final thing I will touch on is surveillance. And, you know, a lot of folks in the HIV movement are very familiar with surveillance. I know another one of the panelists is going to be touching on molecular HIV surveillance. But another way we talk about molecular HIV surveillance is contact tracing. And I'm sure y'all have heard a lot about the expansion of contact tracing in light of COVID-19. You know, some people think contact tracing is great, but whatever your opinion on how it operates and like the purpose of contact tracing, unfortunately, there are no data privacy protections at the federal level, and the protections vary state by state. And so what that means is that law enforcement or even immigration enforcement might have access to someone's health data, right? Like if they have tested positive for COVID-19, that's where contact tracers like typically come in, you know, into contact with that individual and collect their data. It's stored in some sort of database, but there's no firewall between like that person, the contact tracer, and like the information being shared with law enforcement. And so what we've seen is that 35 states are sharing the addresses of persons with COVID-19 with law enforcement, And 10 states are also sharing those people's names in addition to their addresses. And I know, like, I'm laughing, but it's because I'm just like so angry and uncomfortable with that. Like, that's how I show anger. That it is wild to me that anyone thinks it is consistent with public health to share someone's personal information with policing. It's just like, it's inconsistent with public health goals. It leads to further stigma and discrimination for all. And again, like these public health orders, this criminalization of COVID-19 has become yet another tool to police and criminalize and surveil already marginalized populations. So yeah, I will stop there.
Thank you. Thank you so much, Brianna. Of course, this was at the very time that my browser that has Devin's bio decided to freeze on me. So thank you for that. I'm actually going to ask Kamari or Deidre if you could unmute yourself and introduce Devin for us. My deepest apologies. While they're getting ready to do that, I will say personally that I really appreciate being able to work with Devin the last 6 years. We both live in, when I lived in Missouri, did work HIV Justice Coalition, which Missouri has some of the worst laws. And it has been a fight we've been dealing with for over 7 years in Missouri, is how to decriminalize HIV. Somebody ready to go to read Devin's bio? My deepest apologies. I will get things rebooted on my end.
Sure. Yeah, Diane, I got you.
I'm definitely all set for you.
It should be at the top of your
Go
email.
ahead. Yeah, you can do it.
I'm muted.
No, you're good. Go ahead.
Oh, Lord, technology. So it is a pleasure for us to introduce to you Devin. Devin Hersey is an advocate for people living with HIV and public health from Kansas City, Missouri, currently pursuing a dual master's degree in public health and strategic communications at the University of Missouri, Columbia. In 2019, Hersey was honored as one of the 40 under 40 in public health by De Beaumont. I hope I'm saying that correctly. His local and state work includes legislative advocacy for the Missouri HIV Justice Coalition, board membership of Blackout KC. In addition, Hersey is an appointed member of the CDC HRSA Advisory Committee in HIV and viral hepatitis, communications chair for the U.S. People Living with HIV Caucus, ambassador for the Henry Kaiser Family Foundation's AIDS campaign, Greater Than AIDS campaign, steering committee member of Impact Global Action for Gay Men's Health and Rights, and also is formerly a peer educator at Truman Medical Center as a co-chair for the Youth Pact, a youth ambassador for NASDAD, and a member of the campaign for AIDS Youth Action Institute. I introduce to some and present to others, Devin Hersey.
Thank you for making it through all that. Thank you. Presentations have been excellent. I just want to put that out there. Thank you for everybody who's presented thus far, and I look forward to hearing everyone else. For my portion of the presentation, I'm very intentionally not giving anything that you shouldn't be familiar with, but I really want to change the way that we're thinking about things. It's my belief that there's a bit of cognitive dissonance when it comes to HIV criminalization specifically at the state level. I know that health departments generally denounce the use of criminalization, but a lot of the times our policies don't reflect that we are denouncing criminalization. And like I said, I believe that's a bit of cognitive dissonance. This presentation will also be brief because we do have time for a little bit more conversational setup toward the end. So I'm gonna start off by acknowledging that the African American community has quite a bit of medical mistrust, which is understandable given the systems and the way that these systems are designed and the way that healthcare has really, just our relationship with healthcare in general. So first, an example of how these how these systems under Ryan White, an example of how they operate is really through, I I want to point out mandated reporting. Let me just point out the slide. So as a peer educator, I worked as a peer educator for several years, and I do consider myself knowledgeable about HIV criminalization and the way it works. But the fact that I worked for a hospital was not really able to provide the sort of support that I feel like would have been appropriate for my clients who would come in accused of exposing someone to HIV. So that's one of the things I just want to call out so that we can reevaluate within the state. Mandated reporting really should account for, you know, some of the things that can happen to someone who's living with HIV. When I think about it, I guess, I don't know, I just feel like it would have been so much, I'd feel so much more comfortable as a person living with HIV if I could trust the same organization that I'm receiving HIV care from to also support me when that information is being misused. I feel like it's really a breach of trust. The next point that I want to move on to is health department and reporting. So there's a lot of very new data that's emerging right now as we're talking about ending the epidemic. There's the data to care that's being thrown out, recency data, which is a form of data that can estimate what can approximate when you were exposed to HIV and when you seroconverted. And as Brianna pointed out, the contact tracing data. But really, what concerns me about this is it seems that we need such specific data to reach Black people when the systems that we have as they exist, like it really doesn't require all that to reach white people, to reach other groups. I feel like it's a part of our oppression. It's a part of the oppression that we experience, especially when we have the threat of HIV criminalization within the state of Missouri. All it really requires is like an accusation to set off a whole cascade of events. And let me back up to talk about the law within Missouri for a little bit. So, of course, if someone is exposed to HIV and they do acquire an HIV diagnosis, it can be considered a Class A felony if you cannot prove that disclosure took place ahead of that sexual encounter or whatever sort of encounter it was. But there's also penalties for someone if transmission does not occur. And those can range from Class B to Class C, which still comes with between 15 years, well, between 5 and 15 years penalty. And the behaviors that really would qualify for that Class B felony include like spitting and biting. So I just an example of how, you know, how useless these policies are. And then lastly, I want to move on to molecular surveillance, which is a concept that we know quite a bit about, well, that most of us know a little bit about. But really, molecular surveillance is the use of phylogenetic data from the HIV genome. And what that means is when someone comes into the clinic and they're being put on meds, there's this initial set of labs that are collected that really help the provider to identify which medications would work best for that person's body. And without the consent of the person living with HIV, these labs are sent for a second round of analysis, which is still a genotype test, but much more specific that can be used to group people according to their, according to who has a similar strain of the HIV virus. And all of that is happening without the consent of those who are living with HIV. So, you know, it kind of concerns me when in my state, for example, we have a law that says that when you're accused of exposing someone to HIV without disclosing of your HIV status, that the health department is required to provide all surveillance information to the prosecution. So it really goes back to that medical mistrust that we have in the first place. It makes it impossible to really trust that even if the health department has your best interest at heart, that they're able to, to protect you when we're really, as people living with HIV, we're dependent on health services in a very particular way. And molecular surveillance, I just want to put out there it's the backbone of the Ending the Epidemic plan. In fact, it is a condition of receiving Ending the Epidemic funding. So it's something that needs to be top of our radar when we're talking about really planning to end the HIV epidemic, especially in those jurisdictions that have been identified. So I just want to make sure that we're thinking about that as we're planning for our state. And I'll go ahead and conclude there. Thanks.
Sorry, I'm back. Sorry about that. So thank you, Devin, for that. I want to introduce our last panelist, and then we're going to open up to everyone else. So Toni Michelle Williams is an auto theorist, and I actually want to know a little bit more about that. Auto theorist, performance artist, embodied leadership and semantics coach, and executive director of Solutions Not Punishment Collaborative, SNAPCO. Grounded in humor and joy, she is a celebrated community organizer in prison abolition, prison reform issues, and leadership development for Black, transgender, LGBTQ people, sex workers, people living with HIV, and Black youth. She has co-led campaigns that resulted in the closure of the Atlanta City Detention Center, ACDC, and the reclassification of cannabis laws, police accountability, and sex worker protections in her home of Atlanta, Georgia, and is matching today with our slides. So I'm going to turn it over to Toni Michelle to close out our piece of panels before we open it up, and she's going to be talking about what the war on Black bodies looks like. Thank you, Toni Michelle.
Hey everybody, thank you so much. I'm really excited to be here with you all today and to be with some of my favorite people and beloveds in the movement. So thank you all for having me. I wanted to just hop on and be brief and talk about what's possible and what's next as we are weighted so heavily with so much death and criminalization and grievance around us. And I wanted to talk to y'all specifically about defunding police. So many people have had questions around defunding police and what that means for how we as communities lead those efforts, and also what it means in relationship to being able to reimagine our futures. Since the beginning of COVID, after the killing of George Floyd and Breonna Taylor and Tony McDade, it was a righteous response, right, to defund police. After failure of literally oppression and the bullshit that we're all facing as Black folks and folks of color. And we talk about the most marginalized of us. And when we talk about defunding, it's not just about cutting city budgets, but it's also about reinvesting those monies that are cut from police departments into community-based services that really meet the basic needs of our folks, particularly folks who are Black, trans, folks who are engaging in sex work and living with HIV. It is really also, again, about being able to reimagine and create and manifest methods outside of policing and surveillance, like Brianna mentioned, and punishment and coercion, right? It's also about a strategy or connected to a larger strategy that Max talked about in regards to the movement for Black lives, that is about abolition. And what it means to really tear shit down and build up things that truly represent what we need to survive and to thrive. And it's about dismantling police policing institutions, and building restorative and transformative ways to respond to violence, interpersonal violence, and systemic violence. With defunding police, there are some things that are possible, right? We can demand that our city and our counties and state reps commit to reducing budgets over the long term. Here in Atlanta, after the murder of Rayshard Brooks in June of this year, we pushed social justice organizations came together to push the Rayshard Brooks bill, which would defund police or reallocate $73 million from the Atlanta Police Department budgets and allocate that into a community trust fund that would increase each year. It was also a part of that demand that the city commits to increasing that budget each year and also committing to divest from that city budget. We also know that we can also demand police from being in schools. We can demand for more housing for people living with HIV and folks who are struggling, and families, Black women, right, who are fighting for their rights to, an autonomy over their own bodies. We can slow down. I'm sorry, because I know that we're doing the things.
We're excited, and we all speak quickly. You're good. You're good.
Okay, I'm sorry. Yep. And so I'll pause there, and I want to shift into how I know it's possible. So I am blessed to be the executive director of a nonprofit called the Solutions Not Punishment Collaborative. SNAPCO started as a project, actually as a coalition that came together in response to the city of Atlanta wanting to pass an ordinance that would banish folks who were charged with sex work or prostitution back in 2013. And we quickly found that the groups that they were targeting were Black trans. We then band together with organizations like the Racial Justice Action Center, Women on the Rise, Positive Women's Network's very own Miss Dee Shambly, and some other folks, social justice orgs in Atlanta, and to offer these solutions as a way to starve the beast. And when I talk about starving the beast, I'm talking about other ways of like defunding police. And since our inception, we have been able to truly invest in the leadership of Black trans women, particularly those who are formerly incarcerated, living with HIV, or engaging in sex work, to lead participatory research projects that, again, have been chipping away at that beast. We've been able to reform marijuana laws in 2017 and offer a pre-arrest aversion initiative to the city of Atlanta that really focused on allowing folks to have less contact with police who were facing quality of life offenses like spitting on the sidewalk or having or dealing or struggling with their mental health issues. And we have seen such an overwhelming response with the city of Atlanta and a true investment in that programming. This year, a part of the budget was they allocated $1.5 million to that program. Again, a program that was led by the most marginalized of us. So it is possible. And in places like Minneapolis and San Francisco and other cities in California, we know that defunding police is going to happen, and it has been happening. And I want to just leave us off with just a little word about our current conditions, which I just truly believe that as we are defunding police and reimagining ways that we are governing ourselves, reimagining ways that we are creating safety within our communities. I just want to remind y'all that y'all are worthy and powerful and enough to join that movement and join that fight. Thank y'all so much for having me. And I'm excited for the open conversation.
Yes, thank you, thank you, thank you. Actually, your last point, and I want to make sure that, if there's any questions, we want to capture them, but your last point of talking about dreaming big, I think it's a hard for a lot of us to kind of sit in that space right now because everything feels so overwhelming and people don't know where to insert themselves into the work because they think what an activist looks like. And I want each of you, if you could touch a little bit about how you see folks entering into the movement. Although this is a Black-centered conversation, that we have many folks that are here that are non-Black, right? And so what does that mean? The difference between ally and accomplice, right? What means showing up versus instead of tokenizing, showing up and letting Black folks lead and letting folks with living with HIV lead. So if you all could just talk a little bit, just kind of popcorn style about where you envision folks being able to step into this work, talking about HIV criminalization, particularly with ASOs that don't necessarily talk about this on a policy level because it's too scary, it's too much, it's too radical. So I just want to give opportunity for the panelists to give your thoughts about that.
That's a huge question, Diane.
It is. With what you were talking about, let me just put that out. With what you're talking about. So, Devin, you talked a lot about like surveillance. Okay. Where can folks enter the conversation? Where can they push? Specifically for you about criminalization. I mean, for surveillance.
So even with that lens of really critiquing Ryan White and, looking at the success of surveillance, that's still a very difficult question. On the one hand, I'll use data to care, for example. It's a very powerful tool and it will definitely save lives, but it's kind of scary, knowing that data is being shared between, multiple agencies that could potentially, get me sent behind bars. I mean, it's just more people knowing my HIV status. It's funny, I was picking up meds from somebody I went to high school. Not that I don't trust the person, but it's, it's weird. But we definitely need to push back when it comes to molecular surveillance. It's very clear that sort of data is harmful. It's very clear. And I believe that we have the support within the state. So yeah, I'll just go ahead and give you that.
Okay. Max, Tony, Michelle, Brianna, any thoughts how folks can enter the work specifically with the lane that you were speaking about? This is part of the work, attending these things, but then like, what do you do beyond after this webinar?
Yeah, I mean, like for COVID-19 and like HIV criminalization, I think it's like as like a policy person, right? Like policy is so unapproachable for intentional reasons, right? Like policy work is in a way like a form sometimes of white supremacy. And so like, how do people like have access to it and inform like policy priorities and decisions? And so I know in COVID-19 stuff, like these, like you said, like these presentations help, like this discussion helps. Like a lot of folks don't really see or understand like how COVID-19 criminalization is showing up in their own communities and that you can respond to it, right? Like through the creation of legislation, through lobbying and advocating for that legislation that would end that type of criminalization, that would create firewalls between law enforcement and immigration enforcement from getting access to your data. And it's through the creation of like the unmasked report that I shared that has the data and the research to support those policy priorities, right? And so I think there's a lot of ways that we can address this, but it's like, one, educating folks on this, talking about the racial disparities and criminalization, and then like activating our communities to organize at the local level and make our demands known and met.
Not everybody has to answer, but I want to give everybody opportunity.
If no one else says something, I do have something else for you.
Come on now.
I'll just go ahead and go and give them time to jump in. So, you know, on the Ryan White level, I think that we kind of know, I think we're kind of over the board structure because it has not worked for so long. People are often not being like fed, they're not giving material to like learn and grow and think critically about the data that they're being offered, about the policies that they're being offered, and I think we need something really new. There was something else, but yeah, I think that we need something more innovative, especially now that we're talking about ending the epidemic.
So I'm gonna tag off what Devin just said in this creating new. I think one of the first things is we have to start to organize even more. And that's the first piece is the education, it's the learning, it's coming on to these particular pieces, then doing a follow-up conversation, having more conversations. And as I said, most of these systems were not built in a day. It took over time to get them there. So if we understand that, it will take us time to build this. Bully's only 2 years old. We got some that we have left to do. I also think about joining existing organizations and thinking how we build. We have the Black Treatment Advocates Network. Actually, both Tony Michelle and Devin are a part of that. And that is a national network where folks are able to talk about this and then also connect with one another. You know, if Devin is doing something in Kansas City, that don't mean he can't hear what the folks are doing out in the Bay or in Mississippi and seeing how in which those are so tied to the work that they're doing. The network building is also one of the most important pieces, and having more people to be able to say why this is wrong. In some of the cases where we've been able to put the most pressure around HIV criminalization cases, it was the local, led by local work, led by local folks, but also having impact and more persuasion coming from national partners and folks that are not necessarily there. I do also want to make sure this is understood that local people should lead whatever work is being done in their jurisdictions. And then the national organizations should come and help. And I have to say that even to myself to remind myself to do so. Those are some of the pieces that we have to continuously do as we are doing the building. And then the next piece is, as we are thinking about that divesting, I am a great person to tell you how to tear down the system. I am not necessarily the best individual to tell you how to build up the new one. So making sure that we have those individuals who are focused upon building that new system, building those new parts. And as Brianna said, it ain't got to be a policy that is too, I actually think most of our policies right now are made so we're not able to see them. We actually need to start putting in policies that are very much like anybody can come up and say, like, I can read this and I can understand how this moves forward. And that means with our different pieces. And that is important as we think about future and the policies and politics that we're doing post-2020. And we're thinking about making sure that people have access to care. When we're actually thinking about making sure who is and isn't criminalized. Further criminalization, we know now, is not how you end the pandemic. So one of the things that we have to think about in the future pieces of our response to COVID-19 and any other thing that is going on and moving forward is, it is not to further criminalize people. How do we further educate folks, get more people involved, and get more buy-in to make sure that we're able to end this? And that's how we also see that whole cultural humility being a part of it. And actually, the people that are most impacted should be leading those efforts.
Yeah. Did you want to add in, Tony Michelle? No, you're good. Okay. So
Diane, I found the rest of my thought. It's the fact
that outer space behind you, and you grabbed it, and you go ahead.
I'm sorry. We're not speaking a common language when it comes to community engagement. I've said this on a few different platforms, but when you're engaging with the health department, they're normally looking for data points. And when you're engaging with community, they're normally looking for leadership. And on the Ryan White level, you know, we're city appointed, we're state appointed to serve on these boards, but we're not engaged as leaders. Like at that level, we should be considered a part of the government, but we're not taught, we're not trained, and we're not engaged as leaders. That's it.
Yeah. we're put aside usually for like a community advisory board or one slot on somebody's board, but then you find out about everything after the decision has been made or late in the process, and then people get mad that the community advisory board is pissed, right? I think that happens time and time again. One of the things that came up from the chat, one of the questions that someone wanted to talk about was, please talk about the medical mistrust HIV criminalization and racist health policies create. And I actually want to add another layer to that because we're talking about COVID. I think on two sides of talking about medical mistrust, we have one that people are mistrustful of living with HIV or living with COVID and what it means to enter the medical system because of how we're treated once we're in those systems. But on the other hand, there's a lot of people that don't even trust basic science. And so we have people that aren't wearing masks in hospitals, right? And so if we can talk about kind of the mistrust within the medical system, if you any thoughts about that? Sorry, as I pull my hair out of my glasses.
I really thought Brianna was going to kick this one off. I was like, So when we think about this, there's a history of medical mistrust from the Tuskegee experiment to the work that has been traditionally that was done on Black women who were enslaved and using their bodies in order to see how in which they could move further with science and also to further dehumanize who Black people were. But I don't think that is what I was on a medical mistrust webinar a couple weeks ago. And like some folks said, that isn't what most Black people are thinking about when they go in. I think most Black people are just thinking about this doctor's probably not going to listen to me, or they're thinking about Serena Williams and what she most recently went with trying to have birth, or thinking about the different, I know comedian Faison who went to who was like, don't go to the hospital if you got COVID-19 because it's just it's just going to end up worse for you. And hearing those real interactions of folks are dealing with. And we've heard that around HIV for years, where I remember the first time that where I ever was told about, ever talked about PrEP to a Black trans woman, and she said, that's some white people shit. Mm-hmm. So when we think about how in which we're thinking about this, is like there's a natural, I don't know what this is, I don't trust it, and especially it's come from a system that has historically not messed with us and not been there for the things that are going on with our communities. But then you add a layer to it with an administration that fundamentally does not care about those who are most impacted by COVID-19. And there's a reason we have over 200,000, getting close to 220,000 folks that have passed away due to COVID-19. Disproportionately Black and brown bodies a part of that. And as we even think about some of them have been in more folks who have been in the hospital, lost something, lost a job, lost something connected, that got out, had a big medical bill, and they're like, whoa, what is this? And then having a president that tells us, hey, you ain't gotta wear a mask. It is purposeful misinformation that we've seen historically from our government at different times. We have to counteract that with proper information from our different agencies and organizations. We have to call out when our federal government is fundamentally failing us in this time, and continuously after this election, however it goes, we have to continue to put that pressure, no matter who it is, and put more pressure on them to say, hey, this is what you have to actually do to make sure that we are dealing with COVID-19 in a way that actually centers the people most impacted. And if anybody should be doing that, it is actually HIV organizations who have a history of some HIV organizations have a history of trying to make sure those people living with HIV that are most impacted are actually in the front part of this. And I'm gonna stop there. Let the others get a little taste on this.
Little rant. Go ahead. Ready, set, go. Tony, Michelle, Brianna, Devin, y'all are muted, just so y'all know if you're saying something.
Max said it all. It was the perfect answer. Go in.
Y'all are getting a tease of what our planning meetings are like.
I was just going to say the point that I really wanted to drive home in my presentation is that this is a system. So I think it's important for us to consider that a lot of the services that we're offered are coming through the government, and the government is also who is harming us. So I want to make sure that we're thinking about the whole system overall. so it's the responsibility of, HIV prevention and HIV care to correct for the disparities that were created by the government in other areas. So we need to be just as intentional about addressing disparities of race, gender, sexual orientation, all of those things, instead of running away from it. A lot of people get really uncomfortable with these topics and choose to run away from it. And then the other thing that I was really wanting to, reiterate is that, from the provider standpoint, there may be a bit of, cognitive dissonance. We're not seeing that we're doing the opposite of what we intend to do. And it's important to make ourselves aware of that. And, as me being a person living with HIV who's often receiving care, to not have, my occasional mistrust validated feels a lot like gaslighting, because this comes from a very real place. I'm not, when I was younger, I was out there cussing out the nurse. I'm not doing that anymore, but still, I have those scars from that nurse who is not listening to me. And I'm so dependent on healthcare. I have to go in every few months.
Yeah, thank you. I'm like, Devin, you stop cussing out nurses? I don't know about that. But you bring up a good point. I wanted to bring up.
I'm not proud of that.
It's all in the reframe. It's how you phrase your displeasure. I think you bring up a good point too. We were talking about trust, and we think about those that work at ASOs or folks that work at HIV programs, and we're talking about the mistrust of the medical system. But the harder conversation, I think, particularly as Black folk, Black and brown people, is when our people are in those spaces, right? And the respectability comes up, respectability politics comes up, and sometimes our own people are not advocating, right? And that's a survival technique, right? That folks, we need to navigate these systems in order to be quote unquote successful, but in order to keep us in those spaces, we often don't have the advocacy in the ways that we did when we first entered the space. So people get pacified, they move on up the ranks, and then we see people that look like us and they're not doing us justice, right? So my question to the panelists is, what is kind of like your charge, or particularly for Black folks that are on this call that are working with Black administrators, Black physicians, even, folks that are in surveillance and health departments, what does it mean to push those that look like us that are in these spaces that we might want to cuss out during an appointment?
Period. I'll start off. I think, number one, center yourself so you won't cuss somebody out. Take a deep breath. But no, seriously, I think it is really about, number one, committing to your own personal transformation and really, really getting familiar with where you are uncomfortable. Right? And where does that shit lie, in your body and in your mind and in your heart, so that when you are faced in an issue where you have to stand up and interrupt, you have options. And I don't think that we have, because of capitalism, all this shit, we don't really have space to do that deep work. But this is the time for us to, like I was saying in the little spiel, it's this is the time for us to be reimagining how we are in relationship with ourselves, relationship with other people and the organizations that we are collaborating with. And trust me, honey, I'm in that commitment and practice myself. It is that personal transformation that then allows for change or transformation in that moment. I think that's important. I think that as you are committed to that journey for yourself, that you are also, like I was saying, interrupting and challenging people, literally stopping transphobia and homophobia from happening, truly intervening, trusting and believing people's stories when they're telling them to you, right? Truly being present with those stories so that you can generate new ideas and you can be in coordination in a different way. And I think those are all of the key qualities and how we want to be in leadership and how we should be showing up in our leadership. That's, I think, what we are all like desiring or yearning from like these elected officials. But the reality is that we hold that and embody that for ourselves and within our own communities. And so again, how are you practicing holding others accountable? Again, like I said, for myself, I am in that practice. It is hard even for me, but it is being able to recognize that, to be, again, able to be conscious about where it don't feel good inside of you, to then be able to push yourself to the other side of that.
Thank you. Okay. Brianna, Max, Devin, any other thoughts?
I think like if the question is like, how do we hold, people like us who have power or like are in positions of power accountable? Like, what a question, right? Like that is the struggle, I think, like daily. Like Kamari said, it's like deep work is needed. I think Tony Michelle like hit it on the nail, right? Like it starts with us, like in our personal lives, and then it shows up in every point that we operate in. And I know, like, as a policy person who does like legislative advocacy, like for me, it's like I'm a queer Latinx person. There's people like me that are, state legislators or like political officials and executive agencies. And I'm like, look, like I try to form a relationship with them, and I have to call them in every like time and time again to be like, this is the issue. Here is the support. Here is my ask. What have you done to move the needle to meet my ask? When will you meet my ask? Like, what are we doing? Sometimes it really is just repeating yourself over and over again, because the one time you ask for accountability, it's not going to happen immediately, unfortunately. Like, you have to keep on them. And that is emotionally and mentally draining, right? Like, it is draining. But however, like someone's got to do it. And I think like when we have these kind of conversations with each other, where we're talking to one another, like we are mobilizing ourselves in a way where even more of us are then making the ask, that same person that has power. I'll just stop there. It's just like, it's just like, you got to keep making the ask.
Yeah, no, thank you. I think it would bring up a good point about talking about the repetition, particularly with our own folks, as we sometimes think, oh, we'll just have this one-time conversation and things will magically get fixed. No, it's like you have to circle back. And also too, who are your team members that can do that work on the side? Like, hey, can you have this conversation with somebody, right? Especially if it's a peer. One of the questions that came from the chat kind of related to this is, how do we embrace orgs that have caused trauma and they are working on reframing their work, especially in communities of color? Max's face.
Fund them bitches and release it to community.
That's a good.
When I'm thinking about the different institutions that would be thought of for that, and starting to see some of those organizations do some of that transformational work, I think one of the big thing is transparency, continuous transparency to those people that are impacted, which includes their client base, but also on the people within that community. If they're a large aid service organization, is an important piece to thinking about how do we move, what needs to happen. Is it just that we need to change folks on the board? I doubt it. Is it just that we need to change executive leadership? I doubt that either. Is it that we have to also change the way in which people even interact with our work? Does it also mean that we have to change some of our own funding sources? Does it also mean that we also need to give back to more of those communities and make sure some of those pass-through dollars or work is making sure is also mirrored with also local Black-led community-based organizations? Definitely possible. I think there's a number of different layers that folks can do in order to make that happen. I also know, tomorrow the big ASO in town is not just going to go away. So I think there's layers that we have to think about within that divestment piece, but thinking that if an organization is doing due diligence, we got to put tasks to paper, and we got to make sure that that's actually being done. And if you aren't telling folks they're being done, or if you're just saying, oh, we got this racial equity team and they're meeting, that's the biggest bull answer that folks can give around saying that they're working on this. That I think I heard that about from at least 6 or 7 organizations just this year. So we do have to say there has to be something past that, and actually has to be a actual plan in place, and also markers that we can actually see to see, like, is this change not is happening? Because if it's not, we're gonna do what Tony Michelle said.
Oh no, you're breaking up.
You have better Wi-Fi. So I wanted to say that this sounds a lot like a restorative justice question, and I'm not an expert in that area, but I feel on the other end, Black-led organizations and community-led organizations, they exist because they have a very specific critique of whatever's going on. Like, they have a very specific critique of public health. So, I mean, I would think throw everything away and start over, and that's not always helpful. But I guess maybe find ways to incorporate that specific critique into your business model, like from the core, like from the foundation of the organization, if you're willing to do that work after your organization is already established. Otherwise, you might have to go away.
Well, that, Tony Michelle, sometimes you just need to pass the baton and give your resources to somebody else. I think that's a very real point. Tony Michelle, you want to chime in? She's like, I'm good. Okay. We have about 10 minutes left. I wanted to end with a couple quick questions. Thinking about, we touched on this a little bit, but someone asked as a question, what are the steps to accomplices? What are steps to accomplices to leverage their power in addressing what we are discussing? How do they help us tear it down? So what can non-Black folk that are joining us today do to tear this down? I have my own thoughts, but I'm the moderator, so I'm gonna leave it to y'all.
It's like, is this one of these things I can start? Like, maybe like ask like the non-Black
As a non-Black person, I mean.
Yeah, I think it is. I think it's like what a lot of us have said, right? Like, it's show up to support like Black folks that have been leading the work, that have prioritized like what the asks are, that have the lived experience of these particular issues, whether it be HIV criminalization or COVID-19 criminalization. It's showing up and following the lead of and answering the direct and exact asks being made, right? And like, yeah, like that's one way. And then it's also knowing when to stand back and not take up space. And that sounds so easy, yet a lot of people have a lot of time, like a lot of trouble doing both.
Anybody else want to add anything? Devin?
Yeah, well, and this isn't answering your question exactly, it's answering another question you asked. But I just want to acknowledge that our privilege changes over time. And I can say for me, myself, I got into this work really young, and now I am like 30 and people take me seriously. Like, I was saying the same stuff in my 20s and people would laugh at me. I'm saying the same stuff and I can back it up in my 30s. So I'll just say that there's a lot of privilege that comes with that. Also, it's difficult for Black people to, a lot of times, to recognize where we have privilege. And I think it's valuable for people to hold me accountable. Now, sometimes the accountability comes from non-Black people. Sometimes that accountability is absolutely inappropriate. There have been times where someone thought that they were calling me out, but had no moral authority to do so. But with that said, I think that, there's a lot that I can gain from non-Black people. I think that the best thing that can be done is to, support the work that Black-led groups are doing, like ours, to make sure that we can continue to, we're led by Black people, we're involved in the leadership development of Black people, and the services that we provide are benefiting the Black community. So.
Yeah. With that, I will add my one little thing. I think that to both of you and Brianna's point, for me, it comes up with, if you mess up, that doesn't mean you take your toys and go home. That happens a lot where somebody messes up and they're like, but you know, I've been good to you people. They have a Miss Millie moment, right? And so what does that mean to continue to pick up? Because we all screw up in this work and you can't just pick up and go away. Any other thoughts? Anybody want to contribute to that? It's fine. Okay. So with our last few minutes,
I want to add
go ahead,
what Devin was saying, you know, because also knowing Devin in his 20s and seeing him grow into his to being 30, I'm also 30. But I think a few of us were not taken as serious because there was not a more cohesive voice. There wasn't more groups, and now that we have more groups and there has been more organization and continued growth, those voices sound even sound more unison and also have more power because there are also more voices behind them. Because when Devin speaks, he's not just speaking for himself, he's speaking connected to larger networks that also have his back.
Yeah. I think you bring up a good point, is that what we are seeing as often like the outlier, the mad one.
Diane, you going off, but you're on mute.
Oh, can y'all hear me? Thumbs up? Okay. It's okay. Shoot, I lost my train of thought. It's okay. It's okay. All right. So to kind of close out, we have about 5 minutes left. I want to give you all an opportunity just to share briefly, where do you envision from here? You know, Tony Michelle really talked about reimagining, dreaming big, right? Particularly with what you all talked about at the beginning of our discussion today. Like, I kind of always pose this as, if you had a magic wand, what would things look like? What would things look like a year from now? Mind you, we're a week out from this election, right? But what will things look like to you, let's say a year from now? What is your vision?
No hysterectomies without consent. That's top of my list. We would have children who are, you know, with their families. These things are top of mind. I think that, you know, these are definitely issues that the Black community is concerned with. Even though we may not be the most impacted community when it comes to those issues, I think that we're invested in those issues because there's solidarity there. And me being a Black Mexican on top of that. Yeah, so Black leadership, we can, like I said, we have privilege somewhere. We have privilege in some places and not in others. I think that we can be moving in solidarity. In a perfect world, we would be moving in solidarity.
Max, Brianna, Tony, Michelle.
Yeah, I can go. Just one top of my head is a world where Black trans women are not being subjected to so much murder, so much violence, and so much harm and rejection. I also imagine a world where Black boys and Black children in them are having so much joy and clarity and like freedom in their bodies and spirits to self-determine who they are and want to be. And yeah, I'm prayerful that all of the people that I love will still be with me in the flesh, or that I am clear about their role to me as an ancestor or in spirit.
Thank you. Max or Brianna, what is your dream? Oh, you're muted.
We're like pointing to each other, like, you go first, you go first. Yeah, I mean, if I could have anything in the world in a year, I mean, like, I think it's ending criminalization, like based on like who you are, right? Like I think Tony Michelle said, you know, like ending like Black trans women, like any like murder, policing, criminal, like it's just like there's so much, right? Like my biggest dream is just end like harm, violence, and criminalization informed by like anti-Blackness, informed by like transphobia, informed by like just all this bigotry. And I don't know, like that's a lot. Like that's the movement of our lives and our ancestors' lives. But like that is my dream. We could end that in a year. That would be it.
For me, within the year, the dream is to have better access for Black people, to have access to care. No person is being deported from this country. That we are truly working to end how COVID-19 is disproportionately impacting Black and brown bodies in this country. And we are starting to have the long, hard conversations that will be continuously, and that we will continuously check on around where folks are, around truly saying that Black lives do matter and all Black lives matter, and ending the violence from the state that also works on transforming the intra-community violence that is going on.
Thank you, thank you, thank you. For me, I really want Bully to expand. This really started as an idea, stuff that popped off at HIV is not a crime. There were a lot of white tears, Black folk were not happy. And so we created this ourselves. And, you know, the energy that y'all are feeling today, like it's been a really honor to be with everybody in planning this. But, you know, we cut up, we have a good time when we do this. This work is hard, but it is also joyous. So when we meet, like I personally feel fulfilled, and I want all of our movement spaces to be like that. This shit is heavy. We are tired, we are worn out, and we need to celebrate joy and laugh and just be unapologetically ourselves. So that is my vision for the next year. I want to thank all of our panelists, Brianna, Tony Michelle, Max, and Devin for being with us today. I especially want to thank Kamaria, who did all the logistics on this back end, has been holding it down. Vanita for holding us down with our weekly meetings and our planning and our note taking. And Deidre has been helping out with the chat. Deidre, actually, I'll plug her, is doing a talk, I believe tomorrow, on HIV Crim. I saw that in my listserv today. So I really encourage you all to connect with us on a personal level, but also to sign up to get more information about Bully. HIV Not a Crime 4 will be virtual this year. So if you're not already familiar with that space, I recommend that you tap into it. All of the recordings are shared online. I believe on Sarah's YouTube page, you can see the previous sessions. And I really encourage you all, particularly those that work in ASO or HIV programs, have this conversation outside of yourself and maybe a couple folks at your agency. Bring this up in your leadership discussions, right? How are we going to push and talk about surveillance? How are we going to talk about HIV criminalization? ASOs are slowly moving, but those of us that have had these big mouths for 10 years are starting to see a collective movement. Like Devin said, many of us are saying that. So I really recommend you all keep speaking out as much as you can. And yeah, thank you so much. I'm going to pass it to Kamari if she wants to have any final words from the Sarah Project. She didn't know I was going to throw it to her like that.
I did not. I had to like fluff my hair real quick. No, thank you, everyone. This has been an amazing presentation. The chat box has been on fire, partly because I've been contributing my own thoughts. But thanks to each and every one of you. For anybody who's feeling this energy, like this is exactly what Bully in person felt like. So those who feel like they missed out, you just got a taste of it. There is more to come. There will be a future installments from HIV is Not a Crime. The Road to HIV is Not a Crime series. I believe we're in October. So December, there will be a presentation from Thrive SS. So stay tuned for that. If you're not on the Sarah listserv, if someone could drop my email or Tammy's email, or info@sarahproject.com, we'll get you on the listserv. That way you can get all the updated information for webinars that are coming out. And that is all I have. The recording will be available in the slides, and everyone's contact information, plus the links that were shared in the chat will all be available to you after the recording is complete. So thank you again, everyone.
Thank you. Go vote and take care of yourself, particularly the next week. Okay. All right, y'all. Bye.
Thank y'all so very much.
Great job. Bye,
Great
y'all.
job, everyone.
Excellent job, everybody. Take care.
Y'all.